You're watching CTOM TV. Knowledge is power.
The World Health Organization released a report last year. They did an assessment of cancer care around the world. And one of the statistics that stood out to me, specifically about diagnostics, was that cancer diagnostics in Canada are towards the bottom of the pile. Out of 28 countries with public health care that were surveyed, we came out 23 out of 28 for how we diagnose cancer, how effectively, how efficiently, and the tools that we use. So that's a significant statistic. Like we have a lot to be proud of in Canada and in our medical system and what it provides in contrast to other countries. But when it comes to something like cancer, this statistic is something to keep in mind. And again, all the more reason for you to start to take matters a little bit more into your own hands and make sure that you're supplementing what the public healthcare system provides with these enhanced diagnostics and treatments that we'll talk about shortly.
Yeah, and if I may add to that, I love the statistic you added there that when a patient does get an external PET CT or a private PET CT, in over 80% of the time, it changes the plan or the treatment plan that the oncologist had. And you know, from our experience, what we've seen is oncologists treat patients based on CT scans of lumps that weren't necessarily tumors, were benign lumps, and ignore the actual tumors. We've also seen in a lot of cases where patients are told they're cancer-free, and then when we get them a PET CT, we uncover all sorts of tumors. So, you know, I think the statistics of a CT and an MRI in a lot of cancers is about 50%, 60%. So you're missing a lot. With a PET CT, it's up in the 90s, high 90s typically.
You mean accuracy?
Accuracy, and yes, false positives, false negatives, you know, that sort of rate. But importantly, we've seen cases where patients, you know, we had this one terrible case where an individual was being treated for lung cancer, and he was on his sixth chemo treatment. He was an older individual. He decided he was going to sell his business and his house and, you know, do his bucket list. And he came to us and said, you know, I've been on this chemotherapy, and yeah, the chemotherapy's beating me up, but you know, I just don't feel like I have cancer. And I said, well, you know, it's common. A lot of people feel pretty good until, you know, the cancer is very advanced. I said, why don't we get you a PET CT? So we got him a PET CT. And shockingly, he had never had cancer in the first place. The doctors were treating a benign lump that they thought was a tumor based on a CT scan. So having that PET CT is everything in cancer. It's really important because you can miss tumors, or you can be incorrectly diagnosed, or the doctors could be focusing, for example, radiation therapy or other therapies on a lump that's not even a tumor, or maybe is not the most aggressive tumor, and ignoring an aggressive tumor. Mm-hmm. So very important to get a PET CT, regardless of the type of cancer you have.
Yeah. You guys you're probably rolling your eyes right now, everybody. It's like, come on, people, get on with it. We get it. Get a PET CT. So that's good. That's exactly what we want. We want to annoy you into caring for yourself in that way. It's so worth it. So worth it. There's a question in the chat that's specific to PET CT, so we'll address it now. The question was from Allison about whether the radioactive isotope, and specifically the sugar, might actually expedite the growth of a tumor, because we know sugar kind of helps cancer grow. Cancers like sugar, and oftentimes diets specific to cancer care recommend greatly reducing or eliminating sugar altogether. So what effect might the amount of glucose solution with that radioactive isotope influence the growth of a tumor?
Well, I think that's a great question. And I think a lot of people have some confusion on, you know, radiation and cancer and sugar and cancer. So radiation causes mutations in genes that protect you from protect your cells from becoming cancerous. So typically what it does is it causes damage to a class of genes called tumor suppressor genes. And these are genes that are involved in maintaining the integrity of your genome and preventing your cancers from, or your normal cells from developing into cancers. Because cancer is a disease of DNA, of genetic mutations, a high accumulation. So a lot of radiation exposure can cause cancers, 30, 40 years down the road. But it's definitely a long delayed time period because, of course, that's dose dependent. It's a fairly small dose in a PET CT. It's something like a sunburn, a bad sunburn. And then additionally, the sugars are not going to have a lot of impact because that's another long-term feature of cancer. Cancers like sugars, they preferentially drink them, but they can use many different sources or many different molecules for energy. So in actual reality, in certain types of cancers, scientists were noticing that after patients got a PET CT, the cancers are actually responding in we're shrinking, almost like a treatment. So the whole world of PET CT has developed into something called theranostics. And theranostics is targeted radiation of tumors. So in other words, the isotopes that were used to bind onto these tumors, it was a sugar in this particular case with PET CT, with FDG PET CT, has led to a whole new type of treatment where patients get injected with a radioactive isotope that binds onto their tumors. So I would say PET CT in most cases, if it's going to affect your tumors, it's going to slow them down from growing. So it's going to have a positive effect on reducing your cancer.
Well, that's great.
Yeah.
Another question about PET CT from Lucy, which I can address. Given that it is not standard, how do we get one? There are a handful of private PET CT clinics across the country, none on the prairies. In case that's where you are, you'd have to come to BC or head over to Ontario. But there are a bunch. Again, a little administration, a couple of forms to fill out, and usually within a week you have your scan, and within 24 to 48 hours you have your results, which your oncologist will use and apply to your treatment. So there's incredible value in doing that, that's for sure.
Yeah, about 50% of the oncologists that we work with are adamant about PET CT. Another 30% will go with the PET CT once they're explained exactly the context and the importance of it in this particular patient's situation. But however, the vast majority of oncologists in the Canadian system who do swear by PET CTs tell me that in most cases, probably 4 out of 10 cases, they get turned down when they ask or when they submit a PET CT through their local hospital or local treatment facility. So it's not that oncologists don't want this, it's just that the resources are not there to do every Canadian patient. I mean, in BC, we had one PET CT for many, many years, 30, 35,000, 40,000 new cancer diagnoses every year. That machine could do maybe 1,000 or 2,000 PET CTs a year. So we're not even close to that.
Right.
Washington State has, I think, 400 or 500 machines. So, it's just
not quite that many, but they
Canada's not spent the money on that yet. And that's
they're don't quite have 400 or 500, Alex, but the statistic is there are literally almost 4,000 PET CT machines in the US versus 40 in Canada. So just for comparison to, because they're used as part of standard cancer diagnostics in the US and in the UK and other places, Australia, etc.
Thank you for watching CTOM TV. Subscribe below and stay informed.